Hi everyone, I'm Emma,
And I'm Rachel.
and we're here to talk about grooming and personal hygiene for someone who has a tracheostomy and is on mechanical ventilation.
I'm just going to minimize our camera here so you can focus on our presentation. So introducing our patient, we have Annette. So she has mechanical ventilation and a tracheostomy, and she's in chapter 7 of the Lowenstein-Halloran article. And she's a 59-year-old female. She was initially administered into the acute care setting due to her diabetic ketoacidosis and left upper lobe pneumonia. She also had some complications after this, and she had a right-sided pneumothorax, atrial fibrillation, and she also had a period of unresponsiveness. And so after this, the acute kind of care that was necessary transitioned, and so she was okay to go to a long-term care facility. And so that's where she's having this rehab, and that's where our role as OTs is coming in for her case. She also has a history of diabetes, asthma, breast cancer, and she had a mastectomy 10 years ago for that. And she also has limited left shoulder active range of motion. She also has several precautions. So nothing per oral, no blood pressure to be taken on her left upper extremity due to her history of mastectomy, no blood pressure to be taken on her right upper extremity due to a PICC line, and then she also has some new tracheostomy precautions. Occupations that she really enjoys include her main focuses on being grooming and having personal hygiene, which includes oral hygiene, face washing, and hair brushing. And then it's also followed by social participation of as well as home management, driving, and leisure participation. And the main model that we're focusing on is the occupational adaptation frame of reference.
All right, so there's just a few things to keep in mind before we dive into the intervention. The first thing would be the client's precautions. So she's nil per os, which Rachel stated earlier was nothing by mouth. And then she's on new tracheostomy precautions as well. An additional thing to keep in mind is communication barriers. So the client isn't able to verbally communicate due to the tracheostomy, and this is very common for individuals who have just recently gotten a tracheostomy put in, just like adapting to that big change in their body. And then the last thing to keep in mind is her cognition. So it wasn't stated in the case, but there is a possibility for decreased cognition in the client just due to the trauma of all the medical difficulties and things that the client has gone through. And even just like that lack of oxygen can really affect cognition, like we've learned in class. In the case, it did state that the client can only follow one-step commands at this time, leading us to believe that there is some cognition deficits. So the intervention that we have for this client is a oral hygiene routine. So this oral hygiene routine for individuals with tracheostomy and mechanical ventilation is one that's a pretty universal routine that is used quite a bit. And we found some research leading up to this. So the first step is toothbrushing with suctioning. So using a soft bristle toothbrush, toothpaste, and making sure that a suction tube is in the mouth of the client while the toothbrushing is taking place. Although this is a step in the oral hygiene routine, we're not focusing on that part of the intervention that we're teaching you. We're going to focus on the Toothette swabbing. So the second step in the routine is a Toothette swab with mouthwash. And the research that we found shows that the mouthwash containing CHG 12% solution is the most effective in just reducing the bacteria and keeping the oral hygiene good in the patient's mouth. Third step is to use a dry Toothette swab. So after swabbing the mouth with the mouthwash, we use a dry Toothette swab to gather any excess saliva or liquid in the mouth, and that decreases the chance of aspiration for the client with the tracheostomy. And instead of using a dry Toothette swab, some places have suctions that you can use, but in our case, we will be using a dry Toothette swab. And lastly, just washing the face, mostly around the lips, in case there's any debris around the mouth, just from the routine, and then applying Vaseline to the lips because the lips can get very dried and cracked since there is not the liquid and moisture around the mouth for that. And we don't want dryness and cracking to occur. And then just a note, so this would be like the whole morning oral care routine. After this is done throughout the day, toothbrushing only occurs according to the research articles, every 12 hours. And then the Toothette swabbing with mouthwash occurs every 2 to 4 hours as needed. And this helps to maintain hydration and remove excess saliva. And additionally, like I noted earlier, to decrease the bacteria going through the client's mouth.
And so overall, we kind of have quite a few articles to support this intervention. So we found 5 total articles, and here's the article names, and we have a further description listed below in our speaker notes. But some ones I really wanted to highlight for you was that third article, oral hygiene practices for individuals that are on mechanical ventilation, has certain procedures. And if that person also has a tracheostomy, it really includes that brushing teeth with a toothbrush and toothpaste, as well as using suction in our case, and using this mouthwash that we talked about earlier with that 0.12%, can really have antimicrobial properties to reduce that number of bacteria, like Emma stated, in a person's mouth, and that should be repeated every 12 hours. And then similarly, this last article on here by Cutler and Davis in 2005, they kind of stated that the timeline of when to brush and when to swab a person's mouth in suction can be every 12 hours, and then swab with mouthwash every 12 hours as needed. So those are some of the main points that we have there. And then we also have several handouts that we have. So the American Thoracic Society created the Living with a Tracheostomy handout. And we also created one of our own called a handout for Toothette swabs. And so Emma and I will provide printouts of these for you to kind of talk through presenting these with a client, and then kind of running through the steps on this Toothette swab. And so here we have the steps from using a Toothette with a tracheostomy. And so first things first, I'm going to make sure that the client is comfortable and they're in a position to be able to have this oral hygiene routine done. So you can see Emma sitting upright, and she also it seems to be alert. So I could probably ask her some questions ahead of time. I'm wearing proper PPE, so I have my mask on. I have some gloves on my hands as well. And Emma wanted me to perform the oral care for her, so she kind of get a feel of what it should feel like. And then next time she would like to do this herself. So I'd kind of talk through what I'm doing in the instant that I'm starting this routine for her. So I'll start first by asking her if she has any dentures. In this case, she says she doesn't. And then what I'm going to do is pour a small amount of that chlorhexidine gluconate, 12% solution, into a medicine cup. I'm going to then open up a Toothette. I'm being very careful not to actually touch the part that's going to be in her mouth, just to make sure it's still sterile. I'm going to mix it around and make sure that Toothette is pretty full of that solution, but I'm at the edge of the cup. I was rinsing it out a little bit. Then I'm going to scrub along her teeth in a circular motion, as well as her tongue and her gum line. I really want to make sure that Toothette's reaching above the gum line. And then we don't have any suction in this case, but I'm using a dry Toothette now to remove any excess saliva that she were to have in her mouth, just because of that aspiration precaution. So just making sure that the client is going to be safe when you leave the room. I made sure that I took out any of the extra saliva that was possibly there.
And lastly, these are just some clinical reasoning questions that me and Rachel came up with. So the 3 different categories are just emotional well-being, a question about discharge, and then support for the client and her spouse. So these are just questions that we're going to be touching on Tuesday at the end of our little teaching demonstration. We wanted to provide these for you right now, so you guys can go ahead and take a look at them and start thinking about answers and different ways you would approach these scenarios that we've given you. And then, like I said again, at the very end of our demonstration on Tuesday, we will be just discussing some possible answers as a group. And then, so I guess I'll go ahead and read the questions out for you guys. So how do you think that you would be feeling in the situation that the client is in now? How would you ask if she has any strong emotions? How could you address any emotional concerns that the client has? So this is kind of touching on the emotional well-being with the communication deficits that the client might have right now, and just like, how are you assessing that and making sure that is also central in the intervention? and with learning this new routine. The next question is, with the client being discharged to her home environment and into the care of her husband, what are some main things that you want to educate or cover with the client and her husband on in that discharge session to make sure that things run smoothly and they're safe and the client feels comfortable going home to the care of her husband, and vice versa, the husband feels comfortable caring for the client. This next one is kind of a little repeat of the one before, but this one's more so talking about support instead of education. So how do you ensure support for the client after she discharges? And then would you ask her spouse any questions or offer any assistance to him with the discharge and going home? And then lastly, these are some references. So these references include references we used for the slideshow, references or research articles that we used for our information of the intervention, and then the resources that we used for handouts. And if you have any questions, please reach out to Rachel or I, and we look forward to teaching you guys our intervention on Tuesday. Thank you.
Thanks.